To get genetically tested, I'll speak about sort of the whole process of genetic counseling and testing as I understand it. So first, you generally would meet with a genetic counselor, and meeting with a genetic counselor involves going through your personal history, going through your family history as well. A genetic counselor takes an extremely detailed family history. The genetic counselor does not only want to know about the people with cancer. The genetic counselor also wants to know about the people without cancer. They want to know if you have a big family. They want to know if you're adopted. You can still have a genetic predisposition to cancer if you're adopted, and you don't really have a family tree in that situation, but it can be important to test you. I think, some people think that you can only get sort of genes that cause women's cancers from women in your family, but it can come from either the women's side, either your mother's side of the family or your father's side of the family. So a genetic counselor takes a very thorough family history. Now, the family members that are important are first-degree relatives, and that would be your parents, your brothers and sisters, or your kids. Those are all first-degree relatives. Second-degree relatives are one removed from that. So your grandparents, your grandkids, your aunts and uncles, those would be second-degree relatives. And third degree is sort of one more than that. So generally, you can think about cousins, great-grandparents. Not everybody knows their whole family history, and that's okay. A genetic counselor is just going to try to get from the family history as much as possible. Now, the things that a genetic counselor is going to want to know is the ages of people in general, if they're alive, if they're not alive, how old they were when they died. They'll want to know the sexes of the people. They'll want to know if they had any cancers at all, and they'll want to know the ages of onset of those cancers. Now, lots of times a genetic counselor will be sometimes people say, well, my grandmother had stomach cancer. Well, stomach cancer could be ovarian cancer, or it could be colon cancer. It could be a lot of different cancers. And lots of times a genetic counselor will help you ascertain exactly what kind of cancer that was. So the genetic counselor is going to spend some time going through with you your family history. And then she or he will look at the pedigree and see what it shows. The pedigree is literally the drawing of the family tree, and once that's drawn out, you can see if there are patterns that are suggestive of a family cancer syndrome. The genetic counselor will then make a decision, along with you, of course, about whether to get testing and which tests to get. There are a whole bunch of tests that you can have. Genetic testing is either a blood draw or a scraping of the lining of your mouth, and those cells or that blood goes off to the lab, and then they run tests on that. That generally takes some time. I would say a minimum of a couple weeks, as long as a couple months. Then those results come back. So part of the process of having genetic counseling and genetic testing is waiting, and nobody likes to wait for results, but you definitely wait on these results. There's no instant answer here. When you get the results back, you go again and you sit with your genetic counselor and you go through those results. It's really important that you understand the results of your genetic testing. If you have genetic testing and you get results, but you are not given a context in which to interpret them, they're not really very useful. Genetics basically will give you numerical probabilities of how likely it is for you to get such and such a cancer, and it's important to know how to manage that. Some cancers can be prevented completely. Some cancers can be picked up early by screening, and you kind of need to know how you need to be followed and by whom and what needs to happen, and a genetic counselor can help guide you the right way there. Now, and even if you've met with a genetic counselor, had your testing, and had your follow-up visit for your results, a genetic counselor will often have you check in with him or her maybe on a yearly basis, because this field changes really quickly. I mean, there is a lot that happens in this field, and a genetic counselor can be your guide to figuring out if something's new, if there's something new you need to know. Another thing a genetic counselor will do is let you know, based on your results, which other family members would benefit from knowing these results and what your other family members can do about them.
Hi, I'm Dr. Jay Harness, and I want to share with you important information that I believe that every newly diagnosed patient with breast cancer needs to know.
I'm a breast cancer survivor. I am a breast cancer survivor.
I am a breast cancer survivor.
And I want every woman to know
About personalized breast cancer treatment
and the genomic test.
A test that helps guide a woman and her doctor
to the best treatment options for her.
Pass it on.